Okay, so medicinal cannabis basically means that it's come from the cannabis plant. It's generally made up of two main basic constituents, THC and CBD. There are other constituents which include terpenes, and also other things such as hydrocarbons, phenols, and other things like that. But in essence, the medicinal cannabis bit that we are most sort of concerned with are the two main constituents of THC, CBD. Now, the varying different products out there are as a result of the different ratio of these two main products. And basically, the varying ratios are used for various different medical conditions. As we know, and as evidence has shown, it is quite widely used for chronic pain conditions. And in particular, as mentioned before, it can be used for nerve-related issues such as neuropathy. It can be used for musculoskeletal conditions such as osteoarthritis, rheumatoid arthritis, and also for quite widespread pain conditions such as fibromyalgia. It has uses in other medical problems, particularly in the psychiatric field, in particular talking about anxiety, depression and PTSD, for example, which is post-traumatic stress disorder. It is used widely for these type of conditions. It can be used for other medical problems, specifically which is licensed within the NHS. We talk about things like spasticity as a result of multiple sclerosis. It can be used for nausea and vomiting after having chemotherapy, and also it can be used in epilepsy. And this is one of the main things that made it legalized in this country. So as you are aware, the products out there have a varying degree of THC and CBD, and it is the ratio that determines its usages. The most important thing about medicinal cannabis is that you consult a specific specialist doctor regarding your medical condition. He will then be able to determine a trial of medicinal cannabis, which I have to say does take a bit of time. It can take up to many weeks for it to work. But in essence, what happens is you are given the medication, you start at a very low dose initially to see how you react and how you tolerate the medication. And then what happens is that you slowly increase the dosages to an effective level. Hopefully it will be effective, but as I mentioned at the start, it is a trial process and there is a possibility that it might not work, like with all types of medication. So it's important to understand that, first of all, the effects may not be seen immediately. It does take a bit of time, and hopefully you will reach a level